create a multilingual, inclusive space. Esta llamada será en inglés y español. Las personas que no son completamente bilingües deben escoger un canal de idioma. This call will be in English and in Spanish, and participants who are not fully bilingual should choose a language channel. Todo el mundo va a tener la capacidad de escuchar a todos los demás, pero si selecciona un canal de idioma, van a tener la posibilidad de escuchar también a la intérprete cuando se habla un idioma que no entiende. Regardless, everyone will be able to hear everyone else, but if you select a language channel, you will also be able to hear the interpreter when there is a language spoken that you don't understand. Y creamos estos espacios multilingües entre todo el mundo. Entonces les pedimos que hablen despacio y que sean conscientes de la accesibilidad, que solo una persona hable a la vez, y si tiene problemas tecnológicos, que no sufran en silencio y pidan apoyo, por favor. We create these multilingual spaces together, so we ask you to please go slowly, to be mindful of accessibility. One person, please speak at a time. Speak clearly and don't suffer in silence. If you have technological problems, Maddie will tell you who to reach out to if there is a problem. Y queremos que nos dé la señal con la mano para indicar que haya podido unirse a su canal de interpretación. Las instrucciones están en pantalla que indican cómo conectarse. Please give us a thumbs up or wave your hand to let us know that you've been able to get onto the language channel before we start. The instructions for getting connected are on the screen. Entonces, por favor, para habilitar la interpretación, haga clic en el globito, escoja su idioma y ya estuvo. So all you have to do is click on the interpreter button at the bottom of the screen, click on the language that you want to listen to, and that's basically it. Thank you. Gracias.
Great. Thank you so much, Susan. And as Susan said, if you have any technical problems with the interpretation system, you can message either, I think you can message directly or in the chat to Kate Barut, who's here to do support on language. And yeah, let's get started. So this webinar is focusing on our dental and vision programs. We have group insurance plans for all of our member workplaces across the United States. So we're gonna do mostly an overview of that. But first we'll do an overview more briefly of our worker benefits program. We'll talk about some health insurance key terms and concepts just to make sure everyone is on the same page. Then we'll look in depth at those dental and vision plans. We'll talk about the eligibility and requirements. We'll talk about the open enrollment process, and then we'll have some time for a Q&A. And so I like to do this at the start of every webinar just to remind everyone, including myself, of why we do this work. We at the Federation believe that healthcare is a human right and that the US healthcare system is woefully inadequate to provide that human right to everyone. So through the worker benefits program, we can try and make our healthcare system a little bit easier to access, a little bit more affordable, and we can also just work together and support each other within our worker cooperative movement and community by having us advocating on behalf of worker co-ops and in the specific interests and needs of worker co-ops. And also our friends. Members of the Federation who are not worker co-ops can also join these benefits programs. So, healthcare is a human right. So the worker benefits program has grown a lot this year. I came on staff of the Federation in January, in part in order to grow the program that Mo and Kate and others at the Federation started out so beautifully, with also with the support of Matthew. So this year, in addition to the dental and vision insurance that we've been offering for the past few years, we're introducing accident and disability insurance. We'll have a webinar on that in September, in late September. We also have tax advantage reimbursement plans, which you might know as an HRA, an HSA, or an FSA that's available through our partners at the Harrison Group. We ran a webinar on that in late July and have those recordings on our website. We also have some health insurance available through Matthew's company, Diversified Human Solutions, where he can help find some group rates for health insurance in different states. And so by accessing worker benefits through the Federation, we can together bargain for better rates and benefits from insurance companies in ways that when we're small groups scattered around the country, we can't necessarily do. And you also get access to me to support with troubleshooting or figuring out who the person is to ask a specific question about benefits. Also, I didn't mention that we're going to have some referrals to retirement savings plans that we'll be sharing more about later on this fall. So I want to go over some key terms of insurance that I think are just words that we hear a lot about when learning about health insurance policy that don't necessarily always get defined and are sometimes confusing. So to start, we have a health insurance or an insurance premium, which is the amount of money that you pay each month or sometimes on a different time interval to an insurance company in order to have access to those insurance benefits. Then there's the deductible, which is the amount that an individual has to pay towards healthcare costs as they come up before the insurance benefits that you're paying for through your premium kick in. Then there's the copay, which is the rate that you pay to a medical provider or to a pharmacist or whoever at the time that you receive care. And then additionally, there is co-insurance, which not all plans have, but some plans do, which is the amount that you have to pay after you pay your deductible, but before you pay all of your out-of-pocket maximum, which is the maximum amount of money that the insurance company says you have to pay before you don't have to pay anything else. So to start getting more in detail with the dental and vision programs, one of the reasons why we can offer these through the Federation is that these dental and vision plans are national policies. Health insurance that's general medical insurance happens on a state-by-state market level. And so dental and vision programs are a little bit more flexible, and so we can offer these programs with a national network that allows any member co-op or any member workplace in the Federation's membership to join as part of our larger group. And so when we have a bunch of organizations across the country that are small and amazing worker co-ops or worker co-op supporting organizations, it can be hard or impossible to find an advantageous rate for a group of 10 people or 2 people or 20 people. But when you have almost 500 people, like we have in the US Worker Co-op dental plan, we can leverage that to get better rates and also richer benefits, which means that you're going to get better health or better dental insurance or better vision insurance for less money. So yeah, that's it. I always think it's cool to think about it in the scale of 10 people versus 500 people, because that's really a powerful element of the program, and it only gets more powerful as more groups join the program. So when you're paying your premiums for your organization month to month, that's like really going towards this economy of scale that helps and supports people all across the country in getting dental or vision benefits. So yeah, that's the cool part. One of the cool parts. The other cool part is people getting their teeth cleaned and cared for and their eyes. So these are very detailed tables that are hard to read. And so I mostly wanted to include them in these slides so that you can get just sort of familiar with them. We have these documents in detail available as PDFs on our website, and we'll also be sending them out with the materials, including the recordings after the webinar. And so what these benefit summaries show are the categories in which the different types of dental care are divided. There's 3 types, and it shows how much the dental company will cover each type of dental care. So for example, as part of our Emeritus plan, you are eligible for 2 dental cleanings in 2 months, or 2 dental cleanings in 12 months over the course of a year that are covered 100% by Emeritus. It also shows that the deductible, which is the amount you have to pay before the Emeritus insurance kicks in, is $50 per person per year. And then the out-of-pocket maximum, so the most that Emeritus is going to ask you to pay for in-network dental care, probably with some exclusions, but generally, is $1,500. So when you think of how much dental care and dental emergencies can be just horribly expensive and really horrible setbacks, this is really meant to be a safety net for that. And yeah, so that's the overview of what these plans are. I'm not going to go into detail on all of them because I don't think anyone wants me to enumerate a list of dental procedures, but you should definitely go and look at that in detail there. And if you need any help reading them or have questions about what all of this means, you can always email me and I'm happy to help unpack it and help understand what it is. Another great feature of our Emeritus benefits is that they have pretty comprehensive out-of-network coverage. So like with most insurance companies, Emeritus has a network of dentists across the country that it partners with directly to compensate dentists for the cost of the procedures that they do for your teeth. But if you end up or have to go to a specialist or a dentist that's out of network, Emeritus will reimburse for the cost that what they call the usual and customary rate of that procedure. So it means that if you're going to a specialist or a dentist that charges a whole lot for a procedure, the insurance company might not necessarily reimburse you for that whole cost, but they will reimburse you for the cost that they would pay to a dentist that's in network for them. Also, Matt, if I'm getting any of this wrong, feel free to chime in. But
no, you're doing great.
Matthew's done a really great job of helping educate me about this stuff. Cool, so those are dental benefits. We are gonna have time for questions and answers at the end of this. So I'm gonna go into vision, which here we have a similar table that we have for the dental benefits. Vision insurance is, because it does really focus primarily on like the literal vision and not, it's your insurance for your glasses and for your contacts and for your regular eye exams. It's a little less complex than dental care. And and the plans are similarly, there's just less layers to them, it seems to me. But similarly, we have these documents available on our website and will be sent out after the webinar. And you can always email me if you have questions about what these things mean. And yeah, I can support either reps from organizations or individuals within them with unpacking some of this stuff. So who can be part of these plans? So to be part of the U.S. Federation of Worker Co-ops Worker Benefits Program, you do have to be a member, or your organization has to be a member of the federation. That said, organizations in any member class are eligible for these benefits so long as they meet the other conditions of eligibility. Associate members do have to pay a minimum of $500 in dues. As far as payment for the monthly premiums, we require that to be part of the program, organizations must pay at least 50% of the monthly premiums for workers. And we encourage people to pay 100% if possible, or something greater than 50, but the minimum required for workers is 50%. For people who have dependents enrolled in the plans, you can have a partner, spouse, or child dependent on the plans. The workplace does not have to pay those premiums for the additional individuals, but that's also a good thing to do for workers. And yeah, and then for the Emeritus plan, organizations have to have at least 70% of the eligible people who don't already have coverage with, say, a partner enrolled in the plan. So those are the requirements for an organization being part of the program. For individuals within those, workers have to either, for the most part, be on payroll, though if you're an LLC co-op, we can talk about it. And yeah, if you're an LLC co-op, I would just recommend emailing me directly to discuss the specifics of the situation. And yeah, individuals also have to work at least 20 hours a week, though there are also arrangements we can make for situations with seasonal workers. Workers that are enrolled have to either have an individual taxpayer identification number or a social security number. And so that's really important for just to know that if you don't have a social security number, as long as you have an ITIN, you are eligible for the plans. Then yeah, child dependents can be on the plans until they're 26. And partners are available for coverage. Does not need to be someone who is legally married to you. It's possible you may have to show some sort of proof of shared household or bills, but we really want to make this as accessible as possible for people of as many family structures as possible within the confines of the insurance company's rules and regulations. Yeah, and to that end, we also, for the insurance company, people are required to provide legal name and legal sex designation. However, we recognize that not everyone's actual name is the same as their legal name. And so we have spots on our forms for signing up where people can indicate if they have a chosen name that they would like to be referred to in paperwork and in communications within the Federation side, to the extent possible, because we really want to be as safe as we can within the confines of the insurance situation and healthcare regulations to be safe for trans folks and people who use different names than their legal names. So then, organizational responsibilities. As organizations that are enrolled in the program, there are certain things that you need to do in order to get enrollment squared away and to make sure that folks that are within your workplace are up on what they need in order to access these benefits and utilize them and get their teeth cleaned and their eyes checked. So before open enrollment, which is coming up, opening on October 1st, workers need to be informed that they are eligible for dental or vision insurance. As an organization, you can choose if you want to opt into one of those programs or both. And we also need you to share the materials that we're going to share with you with workers in the workplace. And then we'll need and this will all be available, that we have these in forms and documents that you'll all receive, but you'll need to, like in past years, submit a roster, and also every person will need to fill out an individual enrollment form, which is where they'll submit things like social security numbers and legal names in order to keep those things as secure and private as possible and to keep them out of my inbox. I don't want people's social security numbers personally. And yeah, so after open enrollment happens and everything is squared away there, we'll be checking in to see that everyone's received their insurance cards, and organizational representatives, whoever's interfacing with me primarily, will be responsible for checking in with individuals within the workplace to make sure that they've received those cards. And then additionally, making sure that as new workers enter a workplace and are onboarded, they are kept up to date on their eligibility for these programs, and that they know how to sign up and what the costs are. And then we will support with any sort of troubleshooting that we can, in addition to supporting with like finding people who are in network, offering links to figure out who's eligible, and tips to figure out what dentists are in network and what dentists aren't, or ophthalmologists or whoever. And then additionally, workplaces have to inform their departing workers of their Cobra eligibility, which I will go into now. Cobra, and I see your question, Eden, I'll get to it in the Q&A. But Cobra, most workers who are departing their workplace, unless it's for like a particularly egregious reason that they are fired with cause, or there's a pretty significant qualifying reason, workers can opt to continue to pay for their benefits that they've been receiving out of pocket through Cobra, which is Cobra is an acronym that stands for the Consolidated Omnibus Budget Restoration Act, which, congratulations, now you've heard of that. And so yeah, the worker will receive notice of Cobra and then is responsible for taking the necessary steps to enroll and to pay for those. So the workplace doesn't continue to have responsibility for those benefits, the worker does, but the workplace is responsible for notifying the worker that they will have that available. And something that I've been putting together is and have been sharing with folks who have been terminating people from the insurance plans is a sort of short how-to / FAQ about what Cobra is and what to expect. So billing. Billing is going to operate a little bit differently in 2021 from how it's been operating, just to streamline things. So the way that billing works and has been working is that, you know, like I said, we have the big group that is the Federation group that is enrolled in the Emeritus plan for dental and IMED plan for vision benefits. And so each month we receive a big bill from each of these companies for the premiums for these insurances for every member in the worker benefits program that is enrolled. Then we go through and I think most people on this call are enrolled and have probably seen how we do the rosters and the billing, but we'll take each individual roster from each workplace and send off a bill to that workplace for their portion of the premium. So then we collect those premiums over the month and we pay it all to Emeritus as one thing. So that's just the breakdown of kind of how that works and the logic behind it. That same principle will continue in 2021, but we are going to automate how those invoices go out. And so as a result, we're going to be sending out rosters quarterly or when there's a change, rather than a fresh roster every single month. Especially as the program grows, it's just sort of untenable to continue that magnitude. Then you can, as an organization, can either opt to pay those automatically or to pay them individually as they come in automatically each month. So same principle, just a little bit more automated. And then fees for 2021. These are, like, I would say 95% set, but until we get the final rates from the insurance companies, we can't completely, they could shift a little bit, but if they do, it won't be by much. So yeah, these are the rates that are also now available on the website. They're roughly the same as this year, just bumped up a little bit. But the sort of ratios of everything are pretty much the same. Yeah, and so there's each month you'll get the dental or vision or both premiums for each worker or worker and partner or worker and children or family, and those are the 4 different rates for those configurations, same as we've had it before. And then in addition, each month we bill a monthly administrative fee based on the number of workers that are in an organization. So yeah, and this is also, this will go out to everybody after. So yeah, getting started. In order to enroll, email me at benefits@usworker.coop. And this is with, you can email me with specific questions if you have questions, and then I'll send out a template of the roster. And so we ask folks to fill out both a roster with a list of everybody in the plan, but also in addition to that, and in order to enroll, every person in the plan needs to either fill out the form or have their workplace representative fill out the form with their secure information for it. And all of that needs to happen by December 9th, 2020, in order to enroll for January 1st. And yeah, re-enrolling, needs to happen just so that we have record of everybody in the plan for 2021. And that is the checklist of things to do. And now I will answer your questions.
Hey, Maddie, I just want to clarify real quick.
Sure.
About the re-enrolling.
Yeah.
Because we already have a list of the folks that are enrolled, right? So if organizations are already enrolled, how can they just like verify the list or update it?
Yeah. Wow, this is a great wrench in the system of a thing I haven't done before. But yeah, I think we can arrange I can send out the rosters to people who are re-enrolling so that people can either confirm or otherwise edit the roster.
In terms of people re-enrolling,
Mm-hmm.
there's a few ways you can do that. This is Matt Tate, by the way. So there's a website with the online form, which I'm sure a lot of you are familiar with.
Yeah.
You can have everyone go and re-enroll if you want to. That's totally your call. Legally, you know, if I'm putting on my, hey, you better be careful hat, I would say you recommend doing that. In actuality, for most small companies, is, you know, if you send out an email and enough communications that a reasonable person would have known that, hey, if you want to make any changes, go ahead and make any changes. You know, in my back of the napkin thinking and logic and experience and opinion, really, that should suffice. But again, it depends on your organization and how much of a risk tolerance you have, how much, you know, you fear legal repercussions and people reporting you to authorities and that whole thing. But if you want to be super squeaky safe, I would say get another re-enrollment form, either online or via paper or email or some kind of written confirmation from each and every individual. I think that's a little much, but again, everyone's different. In practice, if you get enough materials out via email, written communications and everything like that, where everyone in your organization would have reasonably known that they were supposed to sign something or make a change, if they wanted to make a change, they would have. I think that's a fine enough way to go as well.
Okay. It seems like maybe Matt and Mo and I need to get a little bit of clarity on that, and we will make sure that that is clear in the materials that we send out and have available on the website, so that we've got a solid answer for you there, Eden / probably everyone else who's asking the same thing. But thanks, Matt. Okay, I'm seeing 2 questions from Isla. One, can you speak to why a 20-hour work week is necessary for individuals to be eligible? Matt, can you speak to that, and if that's a rigid insurance rule or not?
It's more of a contract rule. Certain states have that as part of their state law, but for the most part, the hourly work requirement is a contract between the insurance company and the plan sponsor, in this case, the U.S. Federation. So it's just emeritus for whatever reason, and there are probably a number of reasons. They just decided that 20 hours a week is a necessary amount. And typically, if you want to have informal conversations with people like me that do this, the reason for that is it's easy to just kind of give someone a brother, a sister, a cousin, a part-time job, and kind of have them on the books. If it might be a little bit different in a worker-owned cooperative, but imagine a company owned by one person. They can kind of move things around, and they just don't want to be involved in any shenanigans like that. And a 20-hour or a baseline threshold like that throughout the history of insurance has kind of kept that at bay.
Mm-hmm. Okay. And the second question is, do those already enrolled in dental and vision receive a new card? The answer is no. Emeritus and IMED don't send out new cards to people who are already enrolled. If people need a new card, email me at benefits@usworker.coop and I will get a card sent out, and or I can email it to you. Do we have other questions? It's a small group, so it's your time. Okay, Molly's got a couple questions. Cobra is not new. Is Cobra new is the question. And Cobra is not new. We have improved our communications around Cobra and its availability. So yeah, I'm not totally sure how communication around that happened before, but it's something that we're working on and making more available. It's something that every person who has ended benefits should have received information about, sort of independently of the workplace, because of just receiving the like through the address that we had on file for their benefits when they were terminated from the program.
Yep, that's right.
Yeah.
Yeah, we hadn't had a lot of material on that previously, but that's one of the things that we're always trying to improve about the program, is making sure that people know all the different facets of it, and that's one of them. I think we haven't had a ton of people partake of the Cobra benefits, but they have always been there.
Yeah. To clarify for billing, will we now receive a bill quarterly? The answer to that is no. So you'll receive a bill monthly still, but like how now we send out an updated roster of everyone enrolled every single month. It's like to date for that month. That's gonna start happening either when the roster changes or each quarter we'll do it renewed, so that we can automate how those invoices go out. And then will we repeat what we had done a webinar on in July? Oh, yeah. In July, we ran a webinar on the tax advantage reimbursement plans, that's sort of an umbrella term for health savings accounts, health reimbursement arrangements, and flexible savings accounts. And that is a new program that we're offering, and that is available nationwide and has a lot of sort of intricacies. And so we're partnering with an organization that's the whole thing they do, so that they can work with our members to do sort of things that are specific to individual organizations. So that there's a whole webinar on that is recorded on the website that goes into the details. And there's also more information on the website about it as well. And I'm happy to answer any questions over email or get on the phone to talk more. Thanks, Mo, for the recording link.
I would just add one more thing.
Yeah.
I think we'll send this out in the open enrollment communications, but a lot of the things associated with the dental plan are annually. So if people haven't had cleanings, or if people want to get a procedure done now, or think they need a procedure done, whether a little cap or a crown, or I don't know what people might have, a chipped tooth they might kind of want to get fixed or whatnot. It's better to get those done before the end of the year, before the next year. Because there is that annual maximum.
Yeah, I will also say that Emeritus has done a lot. I can't remember off the top of my head exactly what they've done, but they've made some flexibility around the usage of benefits because of COVID and because of dental offices shutting down for a couple of months. Yeah, I use your dental benefits.
It's also, I think, a really great thing to, if you could talk, Maddie, a little bit about the accommodations they made for payments during COVID. Just to share a little bit about how the people that we work with have also been working with us.
Yeah. I mean, I've been pleasantly surprised about what Emeritus has done in terms of they extended the grace period on premium payments for, I don't remember exactly how long, but like a good chunk of time, which is one of the reasons why we were able to extend our deadline for payment on health benefits and then ultimately eliminate them because they created a basically a mechanism to allow us to pause and restart benefits sort of at people's needs, and became a lot more flexible than the sort of like typical regulations that are pretty strict around when people can drop and then come back on the plan. So yeah, feeling appreciative of that. That's allowed us to be pretty flexible. I mean, almost all organizations have maintained their benefits throughout the entire COVID crisis, which is pretty incredible. But it's allowed a couple of organizations to be able to really be flexible and to either pause benefits for the rest of the year or to pause for a couple of months and then gradually bring people back on the plan. So it's been really great to be able to offer that flexibility. So there will be more information regarding disability insurance, responding to the question in the chat. There will be a webinar in September, in late September, which we'll link to that webinar sign up as well in the follow-up email on this. And then, okay, we have a question about rates regarding worker and children. Can you share how that works versus family, the designation? So for a single parent with 3 kids, do they need to be in the family section or the children section? Matt responds, worker and children includes an unlimited number of children, but once you add a spouse or a partner, the family rate kicks in. So family is like 2 adults and however many children. Worker plus children is 1 worker and as many children as you care to offer dental care to, that are your dependents, not just unlimited children in general. Yeah. Cool. These are really good questions. Matt said it's mostly if your partner gets benefits through their work. Sure. Also, it's great that single parents don't have to pay for 2 adults in order to get their kids covered. Cool. We've got a little more time left if anyone has other questions. Otherwise, we can wrap it up. Cool. All right. Well, thank you so much, everybody, for being part of this. Thanks to Matt for being here and Mo and Kate and Ajaka. And thank you so much to Susan, who's been interpreting this whole time. As always, if you email benefits@usworker.coop, you will find me responding pretty quickly. And yeah, it's great to work with all of you, and I look forward to continuing this work together in 2021 or starting it fresh if there's anyone new listening in. And yeah, it's a cool program and really appreciate you all being part of it. So that concludes this webinar. We will send out the recording and the 1 million documents I talked about later this week.
Thanks, Maddie.
Thanks, everyone.
All right, bye-bye.
Bye. Thank you. Thanks.
Thanks, Maddie.